This is Healthy with VCU Health. Coming up, the first in a series of conversations with our Vice President and Chief Diversity Officer at VCU Health, Dr. Marcel Davis, and team members throughout our healthcare system about their commitment to diversity, equity, and inclusion and its impact on health. Here with Dr. Davis today is Dr. Marlon Levy, Interim Chief Executive Officer, VCU Health. He's also the Interim Senior Vice President of VCU Health Sciences. Dr. Levy will discuss how VCU Health's organizational commitment to this work has a positive influence on our patients, workforce, and community. This is Healthy with VCU Health. I'm Cheryl Martin. Welcome to both of you.
Thank you so much, Cheryl.
Great to be with you, Cheryl.
Dr. Davis, let me begin with you. Tell us about your role at VCU Health.
Cheryl, thank you so much. My role as Vice President of Diversity, Equity, and Inclusion, in short form, is to ensure that equity is at the core of everything we do, say, and touch here at the health system. In long form, that means that I partner with all functional areas of HR, like talent acquisition, talent management, learning and development, total rewards, business advisory, and employee relations to ensure that DEI is integrated into all of those areas because HR truly is the heartbeat of our health system. And HR is built to support our team members whose roles are to take care of and support our patients. I also work with clinical leaders to evolve and improve what they are living in our clinical spaces. And this means sometimes having difficult conversations about unconscious bias and microaggressions and the significant impact that those things have on our patient care.
Now, I mentioned that this will be a series of conversations, Dr. Davis, so please talk about the purpose of this series and why you chose to begin with Dr. Levy.
Sure, I'm happy to, and I'm incredibly excited about this series. The purpose of the series is twofold. First, to openly and really transparently discuss health disparities that exist in healthcare. And second, it's really to identify solutions that we at VCU Health are currently working on to close that gap. And so, to set a baseline, the CDC defines health disparities as preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal care that are experienced by socially disadvantaged populations. And really, I chose Dr. Levy as the inaugural guest for this series because he is our interim CEO of VCU Health System. He sets the tone for the things that we commit to, and we all look to him to really be our beacon and set the example. Aside from that, he's brilliant and pretty awesome.
Okay, so Dr. Levy, with that introduction, is there anything you'd like to add about your background?
I'd be delighted. So first of all, Dr. Davis is way exaggerating my qualifications, but that's okay. It's a great privilege to be the interim CEO. I came to VCU in 2015. I came from Texas. I was not in academic medical centers prior to my career, but I'm a transplant surgeon by training and ran transplant teams for a long, long time. I was recruited to VCU to run the transplant team and help it grow, which we've done, developed some expertise on the business side of things, and then was asked to step into the interim CEO role approximately 6 months ago.
Now, VCU Health's mission is to preserve and restore the health for all people of Virginia. Dr. Levy, could you explain what that means and how health equity fits into that mission?
I sure can. I want to maybe take a step back and talk a little bit about DEI more broadly. We bring those two letters together. They're almost glued together now, as they should be. I want to emphasize the D and the I and then focus down more on the E if I can. So diversity and inclusion are not just critical to who we are and what we do, they are essential to our very identity. It's absolute fact that we have a very diverse workforce and very diverse patients. We are a safety net hospital. We're probably the prototypical safety net health system, not just in downtown Richmond, but in rural Virginia with the two facilities that we have, one at South Hill and one in Tappahannock, where, by the way, the performance on health metrics are sometimes as poor as they are in the inner cities with our most vulnerable populations. So it's absolutely essential for us to understand our diversity and be inclusive in our workforce because that reflects our patients as well. Equity is a very specific term, and to me and to all of us, it means, as Dr. Davis has so articulately put it, it means that all parameters of healthcare, not just outcomes, but also access, the ability to see specialists to get the highest level cares, regardless of your social or economic background, are really the same. That doesn't mean, of course, lowering standards to the least performing members of our community, but rather raising the standards so that everybody has the highest achievable standards in terms of performance, for example, outcomes in healthcare, but also access to healthcare, the ability to see specialists or primary care in a timely manner and to get the care that you need as soon as you need it.
So, Dr. Levy, how does this commitment to DEI initiatives influence your leadership at VCU Health?
I think DEI, broadly speaking, is a lens through which we look at every decision we make, every consideration that we have in the area of our workforce, from recruitment to, very importantly, retention, to the programs that we might roll out, for example, continuing education for our team members, and very importantly, focuses on the patients that we treat. I think we would have no credibility with our workforce, for example, if we didn't insist that the most vulnerable populations that we treat have the same outcomes and the same access to care that the least vulnerable populations that we treat. So it's really permeates everything that we do and everything that we think about.
Dr. Davis, can you share examples of how VCU Health is preparing the workforce to address healthcare disparities?
Sure, I'm happy to, but let me take a pause right there and say, Cheryl, now do you understand why I say that Dr. Lee is brilliant?
Yes, okay.
So the DEI team, quite honestly, we're leading many initiatives that prepare our workforce to identify and address health disparities. The foundation for several of these initiatives really is education because that gives us the opportunity to learn from one another. So some examples of the things we're doing: every month we host a live tribute month program to honor and celebrate the tribute for that particular month. For example, Black History Month, Women's History Month, and this month we've got Pride and we've got Caribbean American Heritage Month. And those Tribute Month programs typically have a keynote speaker or a panel presentation with content that is designed to challenge our thinking and really zero in on the importance of equity in healthcare. We also host DIRE conversations. DIRE is an acronym that stands for diversity, inclusion, restoration, and equity. And the goal is to have honest dialogue with each other about our lived experiences and what's happening in our communities, because we know that what happens in our communities, we bring it into the workplace. Another initiative that we recently launched is called Conversation Cafe. And that is an informal welcoming program for all VCU Health System team members that offers team members opportunities to explore various dialects and expressions of our region through group conversations on a variety of topics. And there is so much more that I can share, but these are just some of the key initiatives that are grounded in education.
Dr. Davis, would you let me add to this very nice list? I would be remiss if I didn't call out our Massey Cancer Center, which, by the way, yesterday just was able to officially declare its designation as a comprehensive cancer center, the second in Virginia and the 54th in the nation. I think what really stands out about Massey Cancer Center is its very intentional, very deliberate focus on vulnerable populations, on making sure that our most vulnerable have access to the most advanced cancer care, clinical trials, and frankly, the dialogue that our leader of Massey Cancer Center, Dr. Robert Wynn, who I hope you'll have on one of your podcasts, has had in reaching out to, for example, the faith community and other populations who might be disadvantaged. So I think it's just really important to mention.
That's great. That's great. Now, both of you have covered a lot of information today. Is there anything else that you would like to add? And I start with you again, Dr. Levy.
Well, we've said a lot and probably could talk a lot longer. I'm just deeply grateful for your interest in this area and for your partnership with Dr. Davis, who is simply wonderful and makes us all better.
All right. Dr. Davis, you get the closing thoughts.
Cheryl, thank you. And Dr. Levy, it truly is a pleasure being a servant leader in our organization. It gives me great pride to get up every single day and serve our patients and serve our team members who serve our patients. And truly, systemic racism in healthcare could mean life or death for our patients. And I am so proud to be a part of a health system with leaders who, quite honestly, are not afraid to have difficult conversations related to race, ethnicity, healthcare, and all the other dimensions of diversity. It truly is a reflection of our philosophy of holistic care, which is to treat and care for the entire person.
As we close our podcast, I just want to reiterate VCU Health's mission. It is, quote, to preserve and restore health for all people of Virginia and beyond through innovation in service, research, and education. A big thank you to our guests today, Dr. Marcel Davis and Dr. Marlon Levy, for putting that mission at the center of what you do. Thanks so much to both of you.
Thank you so much, Cheryl.
It's a pleasure, Cheryl.
Now, to learn more about VCU Health and its commitment to diversity, equity, and inclusion, go to vcuhealth.org/DEI. That's vcuhealth.org/DEI. To listen to other podcasts from VCU Health, visit vcuhealth.org/podcast. This is Healthy with VCU Health. I'm Cheryl Martin.